All right, I think we can go ahead and get started. So, welcome. For those who don't know me, my name is Julia Graham. I'm the Public Relations and Social Media Manager for NAMI, Delaware, and Morrow counties. And I'm here tonight with Dr. Parker Huston from Nationwide Children's Hospital to discuss mental health in children. So, welcome, Dr. Huston. We're really glad to have you with us.
Yeah, no problem. Thanks for having me.
All right, and so to get started, I'm just going to read some of your bio. So, Dr. Parker Huston is a licensed clinical psychologist and behavioral health, population health clinical lead at Nationwide Children's Hospital. He is also a program ambassador for the Honor Sleeves movement with Nationwide Children's Hospital. Clinically, he also works part-time in the Comprehensive Pediatric Feeding Clinic. He graduated with a bachelor's degree in psychology from Miami University, and his master's and doctoral degrees were from Michigan State University. He has a current faculty appointment as a clinical assistant professor of pediatrics in the Ohio State University College of Medicine. His primary clinical and research interests are in feeding disorders, behavior change, habit formation, motivation, and learning strategies for children and families. So welcome.
Yeah, thanks a lot.
So to get us started, what does mental illness look like in children? Are the symptoms different than in adults?
Yeah, it's a good place to start. You know, yes and no is the answer to are they different. In children, they don't express themselves in the same way that we do as adults. That's due to developmental reasons, but also language reasons and, their ability to have forethought and to think in context of what their behavior is like. So for children, a lot more of the symptoms we look for are behavioral in nature as well as moods. And so, we'd be thinking about changes in their regular functioning, things like sleep changes and mood changes and behavioral changes. So, for instance, if we're concerned about depressive symptoms, we might say, well, what's their mood like these days and how long has that been going on? But we would also ask, what's their sleep been like? Has that changed drastically from their norm? Or are they eating much more or much less than you would expect? And if they were a social kid before, are they withdrawing from their friends? Or, maybe they were already shy before, but they've become much more reserved and hesitant to even engage with family. And so while some of the symptoms would be similar that we would think of for adults, we're having to read a lot more of their cues from just how they act in their family and with the people that know them best to try and assess how they're doing.
I'm muted. Okay, and so at what point, like if I was a parent and seeing certain things in my child, like what kinds of symptoms, if I saw them in my child, should I be concerned about as far as mental illness?
Hmm. Yeah, the biggest thing that I talk with parents about are functional changes and functional limitations. So it is very normal at various stages of development to be a little bit more sad and moody or a bit more anxious about certain things like new situations, new people, new places. But when we start to get concerned, especially, is when there are functional changes or differences, meaning they're not only nervous about going to school, but you can't get them to go to school. And there's a kicking, screaming fight in the parking lot every day trying to leave them at school, right? So it goes beyond, I have a 7 and a 4-year-old. So my daughter was nervous about going to school this year and we had to work with her on that. But, she wasn't refusing to go. She didn't miss school days because of it, even though it was stressful for us to help her with. So same thing with, if we're thinking about mood symptoms, it's not necessarily every time they're sad for a couple weeks, but it's when that sadness or when that withdrawal or when those mood symptoms lead to, I'm not participating in family activities, I'm not finishing my schoolwork, I'm not engaging with my friends and my social circle. And then, of course, if we hear anything about threats or thoughts of self-injurious behavior. The older kids get, unfortunately, the more that comes into play. Suicide is one of the leading causes of death in kids ages 10 to 14. And so, we become concerned when they might talk about, I just wish I wasn't here anymore, or I wish I was dead. Some of those discussions can be really hard for parents, but you have to take them seriously.
Yeah, so that being said, how early can children be diagnosed with something? And I don't like classifying mental illnesses, but
Mhm,
some of the more major mental illnesses like schizophrenia and
mhm,
bipolar, how
mhm.
early can those be diagnosed?
Well, it's rare for them to be diagnosed in early childhood. The peak onset of a lot of disorders that have psychosis involved, which you mentioned a couple that could have psychosis and psychotic symptoms involved, that usually peaks around late adolescence and early adulthood. And so, if I were to see an 18 or 19-year-old who's displaying some of those symptoms, I would be much more likely to look into that sooner than if I saw a 5 or 6-year-old who was having some of those symptoms. Um, for bipolar disorder, there's some disagreement, I think, amongst professionals and amongst people who work with children about, whether bipolar disorder can truly be diagnosed in young children and at what age that becomes appropriate. And so I know in the latest editions of some of the diagnostic manuals and some of the research on diagnosis, they're trying to encapsulate some of those behaviors and some of those mood difficulties and mood regulation problems within something more developmentally appropriate. And so, the best thing to do, those are both pretty significant symptom clusters that you're talking about, no matter what the age is, if you think someone might qualify for a disorder like that. And so the best thing to do would be to take them to see a qualified professional, probably beyond a typical counselor in the neighborhood, more like a hospital setting where there's some psychiatrists who can work with them, and maybe even to an emergency department to talk about those kind of things.
All right. So now we are recording, and let's see, where were we at? I will start with the last question that I did ask you. I
What kind
think
of
the
treatment?
yes, what kinds of treatment are available for children with mental illness?
There's a really wide variety depending on what the presenting concern is, how old they are, the severity of the impairment, and all of that. So, starting more at the younger age of the spectrum and some of the more common challenges we might see: behavior difficulties, anxiety, mood disorders, um, you know, sleep disorders, things like that. Uh, there's lots of different treatment protocols. There's evidence-based therapies for that. And you can see a wide variety of types of providers too who work with children now, between social workers, professional counselors, psychologists, psychiatrists, things like that. Um, as you get a little bit older, then there are some people who specialize in adolescence, and so you might, if you have an adolescent child who needs some therapy, you might look at someone who specializes more in issues of adolescence, because as any parent of an adolescent knows, they are a different type of animal than people of other ages. And so that's an option. As you get into the more severe end of the spectrum, in both, chronicity or duration of illness versus also severity of how impaired people are, um, you can work with child psychiatrists, and I would certainly recommend, if you're considering or even already taking medication, or your child is, then being connected with a child specific psychiatrist. There's a lot of specialized training that they get, and they have a lot of knowledge about how children interact with medications, and they can answer a lot of questions parents have. And then, of course, the highest level of services are more, urgent and emergent services. So, I'll just use our hospital at Nationwide Children's as an example. We have a special emergency department now at our new Big Lots Behavioral Health Pavilion. And so you can come straight there if it's a mental health concern primarily. And there's people who are specialists in pediatric mental health to do a triage assessment. And then they have lots of different ways of managing it, from safety planning in the ED and going home all the way up to our brand new inpatient unit in the behavioral health pavilion as well, where kids can stay, anywhere from 1 to, I don't know what the higher number of days in the inpatient unit would be, but that of course would be for kids where going home just isn't a safe option for them at the time. So, what I'll say is, maybe 20 or 30 years ago, there were not many options for kids. You were usually seeing a general therapist or psychologist, a general practitioner, and we've gotten more and more specialized to where you can really find someone who probably specializes in the issue that your child is having at the time.
Okay. And let's see. So on the flip side, we've talked a lot about like if your child's like diagnosed with a mental illness, what are some ways parents can maintain their children's mental health?
Ah, I'm happy to talk about that as well. It's one of my personal passions, and one of the reasons why I work for a few programs at the hospital that I'll tell you about. But the biggest thing that we are trying to discuss, and that I discuss in every interview or appearance or talk that I do, is the fact that just having conversations are the most important thing that you and your family can do when it comes to mental health, really for all ages, but especially for children. We have a program at Nationwide Children's called On Our Sleeves, and hopefully a lot of you have heard of that. But it started as a hashtag on social media, but it's really grown into a huge movement of demystifying and destigmatizing children's mental health. And the first way that we want to do that is just by starting more conversations. We want parents to discuss it with their own children. We want parents to discuss it with their spouses and friends and neighbors and extended family. And we want teachers to be able to talk about it in schools more openly and discuss it with parents as well. And so we've developed a lot of programming around how to start the conversation, how to have activities to not only identify children who might be having a mental health problem, but also to improve mental health in general and mental wellness, and to improve, we hear the term resiliency a lot, and people are needing a lot of resiliency these days. There's not a lot in the news that makes you happy these days unless you look for it. And so people are having to tap into those reservoirs of mental energy to get through the current situations going on in the United States and around the world. And so, it's even pressed us further to say, this is why we should have been talking about this all along and not after the fact. So, some of the programming we've had, in May, Mental Health Awareness Month, we started a program called Grow Your Gratitude. You can still go onto our website at onoursleeves.org and search for Grow Your Gratitude. It's a way of focusing at least part of our day on positive and enriching and things that we're grateful for in our life. Even on the toughest day, we can find something that we're grateful for. And so there's prompts there. Parents can use it to talk to their kids. They can, I found it helpful for myself, even as I'm talking to my own children about it. And I do this for a living and focus on it, but I rarely slow myself down to actually ponder these things. And so when I forced my kids to do it, I had to force myself to do it too. And I found that it was really interesting to think about, wow, what am I thankful for today? What do I have to be grateful for on this bummer Monday where all I heard about was, difficult things happening in the world? And so, I could talk about this for probably 2 hours in a row, but the last thing I'll share is something that's actually coming up. And so, people should come back and check out our website later this summer, because we're focusing this summer on mental fitness. And physical fitness, we know, is important, physical exercise, but mental fitness is just as important. And so we really try and focus on doing activities on a daily basis to keep yourself feeling mentally well. And we're going to have a whole series of information and activities to do with families and worksheets and things like that that will be coming out. And you'll hear more from me in various media outlets about that as well as the next school year nears.
Okay, and are we allowed to have a sneak peek on like what some of those mental wellness activities are going to be?
Sure. Yeah, absolutely. Um, so, we're really trying to focus on several areas. The first one is engaging your brain. And so, on a daily basis, we really encourage people to do something that challenges them mentally. And that can be in a lot of different forms, but for kids, I think it's particularly difficult because they've been out of school for a while now, or at least in a very altered learning environment than they're used to. And so, if your kids are like my kids, then they're like, "This is summer. I'm not doing that stuff anymore." And it's easy to just let them go through their days without much of a challenge. But we're encouraging people to do things that make them think hard, try something different, learn a new skill. Even, for kids, like learning to ride a bike, that's a big mental challenge. They're having to think about a lot. And so if your kid is at that age, encourage them, learn a new sport, a new activity, a new way of making art, something like that. So that's one area. We're also discussing mindfulness, and that goes with the Grow Your Gratitude program because that's a type of mindfulness. But on a daily basis, we want people to have some specific time where you're slowing down. You're just thinking about what's going on in your body, what's going on in your brain, and focusing on things that are positive and relaxing for you. And so we encourage, even really young kids can participate by learning deep breathing before bedtime, or some people would include like listening to some quiet music or something like that as a way of just slowing their brain down. And then the last one that I've been focusing on a lot, that I get questions about frequently, is screen time. And it's a really difficult topic because people vary. And so the most common question about screen time is, what's the right number? They want me to give them this is how many minutes per day your child should be on a screen. And if it's more than that, it's bad for them. And if it's less than that, it's okay. But there's not really a number. I would just say, set a limit and keep it. And that means us too, as parents. I have to check myself from, I tell the kids to get off their screen, and then I find myself with my phone in my hand. And it's like, it's not really a good model to set. So I put the phone down and I go engage with them, or I do something different to model good behavior to them. And so those are three of the areas we'll focus on. There will be some other things on top of that, but just some things to consider this summer.
Thank you for that. So,
Yeah.
looping back around kind of to parents talking about mental illness and mental
Mm-hmm.
health with their children, do you think having those kinds of discussions will also help break down the stigma that we've built up about mental health and mental illness?
We're really hoping so, and we believe so, that one of the biggest impediments to children getting the services they need historically has been the shame of both the parent side of things, not wanting to admit, hey, my child has a problem that we need some help for. And I think there's a stigma related to, if I were a better parent or if I had done things differently, this wouldn't have happened. And I correct that stigma all the time in my clinical practice, that I have parents who arrive in my office with lots of guilt about needing to be there in the first place. And so, I understand that it can be really stigmatizing to tell your friends or family, yeah, I need to seek some help for my child. And there's this misnomer that we as parents have ultimate control of our children's mental health, and if we just do the right things, everything will be okay. And you know science tells us that's not true, and experience and history tells us that that's just not the case. So The more parents get comfortable talking about it, both amongst themselves, in the workplace, with their friends, with their kids, and the more kids hear parents being okay with talking about, hey, I feel sad today, and here's why. Or I feel really angry because this happened, or because this didn't happen like I expected it. The more they're likely to open up and learn appropriate emotional responses and emotional language too. And that just breaks down this wall of silence that people typically have of, oh, it's just a phase, they'll grow out of it, or oh, that should be handled in the home, or things like that that I unfortunately have heard a lot in my career.
I'm muted again. Forget to unmute myself. Any final thoughts before we end this meeting?
Well, I just appreciate you guys taking the time to talk with me, and I really appreciate what NAMI does across the country and for Delaware and Morrow County. You know, I'll just say Nationwide Children's Hospital, what we're trying to be is a repository for information related to children's mental health. Um, we're really trying to, excuse the pun, but put our money where our mouth is. And, every resource that we have on our website at onoursleeves.org and all the trainings that we do are all free to the public and openly accessible. And, that's another way that we're trying to make this destigmatized and easier to access is by making it as simple as possible. So if you're an interested parent, grandparent, friend, teacher, please, you can join the movement at onoursleeves.org, and we'll send you occasional emails. You can download lots of our stuff for free. You can also find local resources on there, so you can go search for information on lots of different mental health conditions, but also different practices for mental wellness for both children and adults. So just be engaged and be interested, and that's the most important thing you can do.
Well, thank you very much. We appreciate the time you took to be with us.